Good morning, everyone. Firstly, wonderful to be able to join you all and speak to you about the acceleration of telehealth and remote capabilities during a global pandemic from Icon Group. Look, firstly, Icon is an integrated cancer care provider, and this slide explains it really clearly. We are a chemotherapy compounder. You can see the technician mixing individualised chemotherapy there, transported to the bottom left, one of our pharmacists who dispenses that chemotherapy, of a chemotherapy nurse delivering vital chemotherapy services to a patient at the chairside, and then of course 25 to 30% of cancer patients who are having chemotherapy also have radiotherapy. You can see a radiation therapist in front of the linear accelerator there. So Icon is a truly integrated cancer care provider. This is our global footprint as it stands today. You can see we're across Australia and New Zealand, Singapore, Hong Kong, and mainland China, and a lot of more sites under construction as I present to you today. So we're a leading provider of integrated cancer care, and what we really want to be is the global leader in integrated cancer care, and that really focuses on a few things: continuing to grow our base platform, more horizontal and vertical integration, and we want to continue to expand internationally, particularly with our very strong presence in Singapore, Hong Kong, and mainland China. So obviously, we've all been dealing with a global pandemic over the last 2 years. And these are the three words that I encourage my team to conduct themselves with during that global pandemic. That's let's remain calm, let's remain connected, and let's remain committed. So if you look at our Australian footprint, I'm going to focus on Australia to start with as we move through each of the locations we provide services in. It's very, very big, and Australia is a very large geographical area, and we have many, many cancer centres, many pharmacies, and many chemotherapy compounding services. So I wanted to share this with you. This is a COVID-19 snapshot at a moment in time during our services about what our team was going through. So 95% of clinical staff had completed donning and doffing training, so putting on PPE every single day, and they're still in that PPE. We were screening 1,100 patients per day, making sure that they didn't have COVID. So we're doing that every single day. 12,000 views of the hand washing video that we produced for our team in 1 week, 150,000 views of the COVID-19 Q&A session we did for our clinical staff, 114 screens installed in sites. So those screens to protect team members and patients from COVID-19 infection. We sent 45,000 screening text messages to patients, and we screened 46,200 patients in total and used 420,000 items of PPE. Now I share that with you because that is just a snapshot in time of a particular moment. It was actually May of 2020. And then, of course, responding to a global pandemic, we wanted to keep patients out of our facilities. And to do that, we had to revert to telehealth really, really quickly. And this just gives you an idea. So across those weeks for our medical oncology telehealth consults, we rose to 60 a week. In radiation oncology, almost 70 a week of telehealth consults. And what that was designed to do was to make sure that we could continue delivering care, but keep patients and their families out of our facilities where patients were having treatment. So focused only on patients who were having treatment coming to the facilities, and those patients who were seeing doctors for their initial consults and subsequent consults, we were able to revert to telehealth. And that's been a really important part of the response to a global pandemic. Now, if you look then at our growth in Asia, so as I mentioned, we're in Singapore, we're in Hong Kong, and we're in China. Now, the difference in those locations for us compared to Australia is we treat a lot of international patients, particularly in Singapore and Hong Kong. So immediately we needed to think, how could we provide care to those patients and maintain those relationships with their clinicians if travelling internationally is stopped? Now, here are all our locations across Singapore, and you can see we're at each of the major hospital locations. We wanted to be able to continue to provide care into the surrounding countries, Malaysia, Indonesia, Philippines, Vietnam. And to do that, we had to provide telehealth services and shared care arrangements. And when I talk about shared care arrangements, I'm talking about our partnerships with hospitals in those countries where they could have treatment in their own country, but remain under the care of our experts in Singapore. And we've done that really, really effectively across the global pandemic. And this really gives you an indication of why. So we've been able to deliver our services, continue to deliver them into Vietnam, into the Philippines, into Indonesia, and the list goes on and on and on from our Singapore platform and base. And here's one of our clinicians in Singapore meeting patients via telehealth regularly. So we did exactly the same in Singapore as we had done in Australia, reverting to telehealth really, really quickly. And we're able to do that because we have such significant IT infrastructure as part of ICON. And that's a really, really important part of what we've been able to do. If we then look to our locations in Hong Kong, again, we treated a lot of patients from mainland China. And that's been shut now for a long time and is still shut. So we still needed to be able to reach our patients and also be able to continue to see patients whilst there was lockdown in Hong Kong and people were isolating. And again, via telehealth, making sure that we're providing access to patients despite the challenges that are going on alongside us. And I think what we have seen across ICON is a real acceptance of telehealth, both by practitioners and patients. And that is a really, really important thing. And it's going to stand us in good stead as we continue to move forward. We're saving patients a lot of travel time. We're saving patients expense if they can see the doctor via telehealth. Now, that is not for every patient and is not for every condition. You can't do everything via telehealth. So there's still going to be times where the patients need to come to see their doctors physically for initial consults and subsequent consults. I think there's a significant step forward in our adoption of this technology and patients' adoption of this technology. We then look at our locations in China. It's also really important to note that we haven't been able to have international experts join our team in China on the ground. We've effectively opened 5 cancer centres during a global pandemic. And that means not only have our doctors been had to see patients via telehealth, we've also had to adapt to providing services remotely. And I'm going to focus on that in a moment. And China has been a great achievement for ICON, and we're actually the first Australian healthcare company to deliver cancer treatment in China. So 5 centres open, and we're hoping to really make an impact by helping address China's significant cancer burden. And we're doing that with cutting-edge techniques and Australian expertise, and that's to help meet the ever-growing need. And all of our locations in China are supported by our Australian-based remote services model, which delivers world-class radiation therapy planning, medical physics support, and specialised clinical training for radiation therapists and oncology nurses. And that includes the use of AI technology. And this is really, really important. This robust model eliminates geographical barriers and the barriers that we've had to deal with because of a global pandemic. And it also harnesses technological advances. And by doing that, we're hoping to deliver the best possible care to more communities. And I want to talk about that now within the context of training, quality assurance. So we've been pioneering and using augmented reality headsets. And that's a wearable tablet that enables trainers, mentors, and subject matter experts to be present in any ICON location on demand. And we can see what the wearer is seeing, and we can give assistance or instruction. Now, importantly, it's completely hands-free. It provides video and audio with high-resolution images and external noise cancelling. Wearers can view images, documents, and annotations from their mentor in real time. And this piece of technology has been a significant component of ICON meeting the challenges of a global pandemic. Some of the use cases for this technology, well, we've been using it for training, instructional, interactive, demonstrative, assessing competencies, real-time training. We've been using it for clinical supervision. We've been using it for auditing, which is a really, really important component. And in fact, we used it for the auditing of our Singapore cancer centres by the international arm of the Australian Council of Healthcare Standards. First time it's ever been done, and we're thrilled with the results. They're also using it for commissioning and technical support. And also the big impact of this is the reduction in travel. So a reduction in travel for our experts, our trainers, our auditors and our supervisors, which means you've got more time. You're not sitting in airports. You're not sitting on planes. And with more time means we can do more training. So here to the left-hand side of your screen is one of our radiation therapists in China. You can see he's wearing the augmented reality headset. And to the right is one of our team members in Brisbane supporting that Chinese radiation therapist with training and support about how we're going to use this technology to deliver the best possible care to our patients in China. And again, here's some other examples. Our physics team in China commissioning a linear accelerator, again, wearing the augmented reality headset. So one of our experts, you can see down there in the bottom left of your screen, one of our experts who's actually based in Wellington, New Zealand, providing education, mentorship, training, all via this real-time augmented reality headset. So it's been a significant step forward for us. And again, here's one of our experts in Brisbane wearing the headset, and to the right, demonstrating how we're supporting teams in Hong Kong, Singapore, and China to undertake quality assurance on a daily basis within the realms of radiation therapy. And you see how effective this technology is. And in fact, my team won an Austrade Export Excellence Award for the use of this technology in training their colleagues in China. The list and examples goes on and on and on. Here again is one of the Australian team undertaking quality assurance on a linear accelerator in Brisbane, whilst the China team watches because the technology is identical at all of our China locations, and they're able to teach and learn together in real time. And that has been a significant move forward in meeting the challenges of global pandemic. And here again, there's the experts watching that quality assurance, no matter where they are located in the world, providing education, providing training, providing support, advice, all of those things. And I think you can see from these examples just how applicable this style of technology is to really anything that ICON does in healthcare, and also everything that others do in healthcare. You can imagine training nurses to deliver chemotherapy. All of those things are possible with this augmented reality headset. Again, see here, radiation therapists in China wearing the headset as they're marking up a head and neck patient who's undertaking radiotherapy. So support from anywhere and everywhere across the ICON network, maintaining quality, maintaining safety, upholding really strong dedication to education and training. Then if we look to some of the other things where I think that technology is really applicable, for radiation therapy treatment delivery, we have a brand new style of linear accelerator called an EFOS. And what the EFOS does, without getting too technical, is deliver daily adaptive treatments, which means it enables online adaptation for radiotherapy treatment to account for anatomical changes in the patient, which means that if a tumour is shrinking, our teams can monitor it on a daily basis and adapt the treatment. It's the future of radiation therapy, and really a large potential for dosimetric benefits from being able to change that treatment on a daily basis. So it's really, really exciting. It's automation and it's tools required. It can also be then applied to conventional radiotherapy. So I think this is a very, very big step forward. And you'll see the reason why I wanted to talk to you about it. We're using artificial intelligence to contour organs at risk. We have examples here in the pelvis and the abdomen, so that it allows, again, education, training, support, assisting our doctors. What it also allows us to do is to use artificial intelligence to complement the existing workforce. And what that means is we can meet some of the challenges of workforce shortages for oncology professionals across Australia and Asia, and we're really excited by that opportunity. Um, Basically, what happens is team are able to use the ethos to monitor a patient on a daily basis and select the best plan for the changes in anatomy. Really, really exciting. And you can see here the team in Sydney that have pioneered this technology for us. They've completed over 100 online adaptive fractions. It's probably close to 200 now. And they're continuing to roll out that machine. And we have a second already live at Icon. Now, what we hope to do is eventually you're going to reduce the margins for treating with radiotherapy by using this technology, which means there's going to be less side effects for patients. And it means we're going to increase doses, and hopefully that will lead to much better outcomes, in this case for prostate patients. So that augmented reality headset's really important, because what it also means, when you're starting to use those advanced technologies for radiotherapy that actually sometimes require the doctor to be physically present, we can start to use this technology so that they're monitoring real-time treatments from wherever they are located. That means they could be at another clinic, they could be at home, they could be, on vacation. That's how powerful this technology is. And I think it's really important, because a global pandemic has taught us that we face challenges that mean people cannot always be physically located in the same place. And if we have technology like this, we can overcome those challenges. So really, I hope that's given you an indication of just how quickly Icon was able to adapt and meet the challenges of a global pandemic, both by increasing telehealth markedly to keep patients out of our facilities unless they're having treatment, so to keep those waiting rooms clear. That's what we did with telehealth, and it happened very quickly across our network. And in fact, many of our doctors are still using that uptake today because it's better for patients. They don't always have to travel long distances. And indeed, it's keeping people out of our waiting rooms whilst we are still dealing with particularly the Omicron variant of COVID-19. And as we know, that has had a severe impact both on our patients, but also on our staff, because of close contacts and, our staff being affected with COVID-19 and not being able to come to work. So we continue to face that challenge, and it's about keeping patients out of our facilities if we can, so that the patients who are having treatment are able to attend. You've also seen the use of those augmented reality headsets to remove physical location challenges, to remove geographical borders when it comes to teaching and training, mentoring, quality assurance, risk management. Hopefully all of you can see the applications of that technology, and Icon is going to continue to really push hard to use that technology more and more and more around our global network. The last slide I wanted to share with everyone was really about our people. All the things that I've shown you is about technology. But if you're going to harness technology and meet these challenges, you have to have great people. Now, we are a values-led organisation driven by 3,000 iconic people dedicated to facing the global cancer burden. So everything we do has been underpinned by our values, which is energy, innovate, connect, on purpose, and nurture. And team members are encouraged to never stop learning, with access to dynamic global opportunities and unique development pathways. And what you've seen me present today is really also about those unique development pathways and giving people the opportunity to grow. And the result of those things is an exceptional team delivering the best possible cancer care. Now, our goal as an organisation has always been to honour this mission. Now, the mission is to deliver the best possible cancer care for more people close to home. And if you're going to do that, it requires an exceptional team of people who share in that vision. Now, a global pandemic has meant that delivering care has been even more challenging. We've had to deal with patients who aren't able to access the facilities, staff members who haven't been able to come to work because they've got COVID or they're close contacts. So you need to harness innovation to meet these challenges. And I hope today I've been able to show you just some of the ways that Icon was able to respond to a global pandemic with increased telehealth services, a real pivot to those services, and embracing technology and innovation to enhance our remote services. So thank you for listening today, and I hope you've enjoyed hearing about ICON.